Assalamu alaikum viewers. Today I'm going to discuss N20 denial. What is N20 denial in medical billing? N20 is a remittance advice remarks code used in medical billing. Its official description is service not payable with other service rendered on the same date. Viewers, this means that on the same day, if there are more than one service performed and that service are distinct, unique, and we are billing them without modifier, then the claim will be denied with the reason unbundled or the service not payable with other service rendered on the same day with the remarks code N20. In this case, what we can do, we can append modifier, and we have an example for you to discuss, and I hope that example will help you to understand how to work an N20 denial. Okay, so to more about what is actually the solutions and what does N20 mean, as I mentioned that the N20 denial means that the service you build cannot be reimbursed when billed on the same date as another specific service, usually due to bundling rules, mutually exclusive procedure, national correct coding initiatives edits. Here, if we can see the descriptions here in the meaning that this service mean you bill cannot the service you build cannot be reimbursed when billed on the same date as another specific service. It means that there are more than one service being built, and to avoid the billing denials, exclusive denials as well, and to follow the National Correct Coding Initiative edits. To avoid such denials, you have to follow this rule, and to check if any modifier required for billing them, you can use it. You can append that modifier and resubmit the claim as a corrected, or if you did not submit before, you have to submit it the first by adding modifier. Here we go with example. E&M and procedure on the same day. As I mentioned, there are certain procedures that have been performed on the same day, and what that procedure is, the scenario: bill CPT code 99213 office visit plus 20550, that is the code for injection tendon sheet. So the insurance denied this code 99213 with N20. Now you can see we build the two procedures 99213 and 20550 without adding modifier, and we build insurance, process the claim, adjudicate the claims, and denied 99213 with unbundled. So what we have to do, and what is the reason that we received this? According to the NCCI date, the procedure code 20550 includes an evaluation component, so the E&M 99213 is not payable unless it was a distinct service. If you see that 20550 is having some evaluation components, and 99213 is also evaluation management service, so it's the same level of service that we are billing together, and the insurance denied such kind of claims. The reason behind that, both of them like that should be distinct from each other. These services are different. How to fix these denials? If E&M was for a separate issue, patient had back pain and received a tendon injection, add modifier to the E&M code. As you know, the E&M was separately a separate issue, and for that case there is some other issues with the patients, some other kind of pain on the back side of the patient, and for that we have to add modifier 25 with the E&M code. The corrected code will be 99213 along with modifier 25, and the other code 20550 will be billed without modifier. So that is actually the solution. The claim will be reimbursed and paid. The key tips for avoiding N20 denials: using CCI edits tools, CMS9 CCI tools, or Encoded Pro. softwares, always check if the modifier 25 or 59 are justifiable. Improper use can lead to audits. Keep clear documentation of each distinct service provided. Viewers, if you see that there are some tips that I be provided to you. The first thing that you have to see the NCCI edits or to check which CPT code require the modifiers and which combination should be okay, should be accurate to bill. In that case, you can take help from the NCCI tools and also encoder softwares, which you can purchase, the ownership for that, and you can then use their services from them. And the other thing is the modifier and the clear documentation. Thank you. Bye.